And so for a lot of healthcare professionals, they really don't want to necessarily do network marketing. They don't want to go out and talk to fellow practitioners and build a distribution network, but they do want to make this available to their patients. And so that's really half of this business model. It's
Joining me this evening is Dr. Dick Walker, who has retired from medical practice, but he used to be a emergency room physician who has been double boarded for internal medicine and emergency medicine, and also has an additional degree in medical nutrition. After 30 some years of practice, he found ASEA not only help him personally, but also help a lot of other people, including myself. So I want to record this conversation with Dr. Walker so he can just convey some of his knowledge and experience and pearls of wisdom to those who are looking at this as a potential to add to their practice. I've talked to a few different healthcare providers, and they were in private practice. There's no strict rule that said they can't do that, but there's even after understanding the breakthrough or potential benefit of the product, there's still kind of hesitance. Do you see that in some of the healthcare providers that you have contacted with?
Yeah, very definitely. One of the goals that I set for myself when I first started this, in addition to helping friends, family, patients, just people who I knew who had a need for this because they had a health challenge that was not responding to conventional medicine and modalities. One of the other things I wanted to do was be sort of a link to the health professional field to say, hey, this is really something you take a look at. This technology is incredible, and it can be a good, additional business, income source for you if you so choose. And what I found was that chiropractors tend to be more open to that than MDs and DOs, for example, because it just is recommending nutritional products is oftentimes part of their business model anyway. It's just that they've never heard of ASEA Redox. And so there's really two parts to the ASEA business model. It's really a combination of direct selling or direct marketing, and then the other arm of this is MLM or network marketing. But you can choose one and not the other. And so for a lot of healthcare professionals, they really don't want to necessarily do network marketing. They don't want to go out and talk to fellow practitioners and build a distribution network, but they do want to make this available to their patients. And so that's really half of this business model. It's having a bit of product in your clinic if you want to. Getting your patients started on it that way. They can purchase it through your office, and then they can, and you can show them and facilitate them getting those patients who are interested in an ongoing relationship with ASEA to just become a preferred customer, and then either their office staff or somebody at the office can show them how to enroll as a preferred customer. And of course, that is building a business through your office, because each time those patients who are now ASEA customers get their monthly ASEA subscription, you get a thank you note from ASEA in the form of a check. And so that is a business model, and it doesn't involve enrolling anybody else in the business. You're essentially making the product available to your patients in a way that allows them to save money and to help them to be consistent users of ASEA. They don't have to come into the office to get another case of ASEA. They get it through the mail, and that really encourages them to take this for long enough to see a result. And so that's part of the business model. That's a valid. That is the be all and end all part for a lot of health practitioners, because they don't want to do the network marketing part, but some of them do. About maybe 5 or 10% say, I've got some other practitioners who might be interested in this, like give them a call, see if they want to take a look. So you can engage in that part as well, but there's no requirement that you do so.
Yeah.
And so
So in a sense, it's not very different from the optometrist's office, also helping people get the frames and the lenses of the glasses, and you know they would get some commission in marketing the product, and it's also a convenience to the people that they see.
exactly. And I see dentists doing that model. They're familiar with providing ancillary products to their patients who they think will improve their oral health. This is no different, except it's a very powerful technology that can really improve oral health. So, I'm seeing dentists, MDs, DOs, chiropractors, all taking a look at this. But you're right, some of them, for one reason or another, don't really want to engage in the MLM network marketing side of it. But there's no requirement for them to do that.
Mhm.
They can build a nice supplemental income if they'd like to, simply doing the providing this product and getting people started on this product.
So another concern they may have is that, let's say if they're marketing some vitamins, because vitamins is something that everybody know, and so this is something that most of their clients or patients do not understand. So they would be concerned, oh, do I have enough time to educate the patient? Are there good resources for them to help the patients or clients get to know
Sure.
the science?
Yeah, there are an abundant resources for them to do that with. They can certainly do it the old-fashioned way and have a handout that they can give them.
Hmm.
Uh, there's a number of different websites that they can give to their patients, maybe on a business card. RealRedoxResults.com is a really good one. It's a
Hmm.
bunch of testimonies and also a 10-minute video that explains the business. That's a workhorse website that a lot of us use. So yeah, there are plenty of ways for them to introduce this to their patients without it taking any significant amount of their time, which makes it even more convenient.
Yeah. Yeah. And so once the patients or clients get to use it and they experience the benefit, they probably would be able to, spread the information to other people as well. Yeah.
Absolutely. And what some health practitioners are finding is that even though they are not necessarily interested in the networking part of it, sometimes their patients are. And their patients are asking them, hey, is this one of those MLM network marketing companies? And if so, could I get involved? Because I've got some friends or family members who would like to see the same benefits I'm getting. And so they may actually develop that kind of a business without any active, without it being an active part of what they're doing. In fact, that's pretty common actually.
Hmm.
Patients
Yeah.
want to do that. Yeah.
Yeah. So, for those healthcare professionals who had some exposure to um, this marketing model, the MLM models, and said, no, that didn't work for me, or something like that, had to really uh, something that I had a bad experience before. What would be your advice to them?
I think my advice would be that oftentimes uh, the reason that didn't work for you earlier was that you didn't have an incredible standalone product with no competition that's an incredible uh, boon to health. You may have had a nutritional that wasn't all that different from another number of other nutritionals in the marketplace. And so it was difficult to stand out. But we have an incredible breakthrough product in ASEA that nobody else has. There's no competition. And so we have a unique opportunity here because we've got the business model if you want to partake of it, but we also have a technology and a product that nobody else has that is absolutely incredible at helping people restore their health. And so you may have not had the greatest success in the past, but that doesn't mean that you couldn't by trying what we have here with ASEA, because there's a number of advantages with ASEA on both sides of this business model.
Now, could you give a little more insight into why it's so unique?
Well, it's unique because people think of ASEA as a nutritional product. It
Mm.
really isn't. There's no nutritional value in ASEA. It is a cell signaling product. So it does things that no conventional nutritional supplement can do. It's not a building block for new cells. It's actually the command structure for opening up the repair pathways that our body uses to fix and repair or replace damaged cells. So it's entirely different than anything else on the market. And that was another reason why ASEA chose this kind of marketing, direct sales, direct marketing, whatever you want to call it, because it really requires somebody to educate a potential customer about what this is and how it works, because there's nothing else like it. So you can't say, oh, this is like so and so, but better. It's the only product in the market that is a cell signaling product, and it does things that no other product in the marketplace does. And so that was really one of the unique reasons why ASEA chose this person-to-person referral marketing, because it does require some explanation to get people to take a look at this and realize what it can do for them and why it's such a powerful wellness product.